Welcome. Today we're diving into gastroparesis, a condition that affects the normal movement of food from your stomach to your small intestine. We'll explore what causes it, how it affects your body, and what you can do about it. So, what causes gastroparesis? The exact cause is often unknown, and we call that idiopathic gastroparesis. However, some common culprits include diabetes, which can damage the vagus nerve controlling stomach muscles. Surgical procedures on the stomach or vagus nerve can also lead to gastroparesis. Other potential causes are certain medications, particularly opioids and anticholinergics, neurological conditions like Parkinson's disease or multiple sclerosis, and even viral infections. To understand gastroparesis, think about your stomach as a mixer. Normally, it churns food and then slowly pushes it into the small intestine for further digestion. This movement is controlled by the vagus nerve, which signals the stomach muscles to contract. In gastroparesis, the vagus nerve is damaged or doesn't function properly, leading to slowed or stopped contractions. Food then sits in the stomach for too long, potentially leading to various symptoms. Gastroparesis affects a significant number of people. It's estimated that it affects between 10 and 50 people per 100,000 in the United States. While it can occur at any age, it's more frequently diagnosed in middle-aged women. Diabetes is a major risk factor, so the incidence of gastroparesis is linked to the prevalence of diabetes in different populations. The signs and symptoms of gastroparesis can vary significantly from person to person. Some common ones include nausea, vomiting, sometimes undigested food from hours earlier, a feeling of fullness after eating only a small amount of food, abdominal bloating, abdominal pain, heartburn, changes in blood sugar levels, especially in people with diabetes, lack of appetite, and even weight loss in severe cases. The severity of these symptoms can fluctuate and are not always consistent. Diagnosing gastroparesis usually involves a combination of methods. Your doctor will first review your medical history and perform a physical exam. Then, they'll likely order tests to rule out other conditions and confirm gastroparesis. A gastric emptying study is the gold standard. This test measures how quickly food empties from your stomach. Other tests might include an upper endoscopy to visualize the stomach lining and rule out blockages, and blood tests to check for underlying conditions like diabetes or electrolyte imbalances. While there aren't distinct types of gastroparesis, it's often classified based on the underlying cause. So you might hear about diabetic gastroparesis when it's caused by diabetes, or post-surgical gastroparesis when it follows a surgery. Idiopathic gastroparesis refers to cases where the cause remains unknown. Treatment for gastroparesis focuses on managing symptoms and improving gastric emptying. Dietary changes are often the first line of defense, eating smaller, more frequent meals, choosing low-fat foods, avoiding carbonated beverages, and staying well hydrated. Medications may include prokinetics, which help speed up stomach emptying, and antiemetics to reduce nausea and vomiting. In severe cases, a feeding tube, a jejunostomy tube, may be necessary to provide nutrition directly to the small intestine. Gastric electrical stimulation is another option. It involves implanting a device that sends mild electrical pulses to stimulate stomach muscle contractions. In rare cases, surgery to create a gastric outlet may be considered. Unfortunately, there's no surefire way to completely prevent gastroparesis, especially if the cause is unknown. However, if you have diabetes, carefully managing your blood sugar levels can significantly reduce your risk. Avoiding unnecessary abdominal surgeries and being cautious with medications known to slow gastric emptying can also help. The prognosis for gastroparesis varies depending on the underlying cause and severity of symptoms. While it's often a chronic condition, many people can manage their symptoms effectively with dietary changes, medications, and lifestyle adjustments. Research is ongoing to better understand the causes of gastroparesis and develop more effective treatments. Areas of focus include improving prokinetic drugs, exploring new drug targets, and refining gastric electrical stimulation techniques. Studies are also investigating the role of gut microbiota in gastroparesis and the potential for targeted therapies to restore a healthy gut environment.